Today we have an interesting guest in this interview. We have a man from Peru, from area of Cusco in Peru. He comes from a city that has a spectacular hospital that he has been building. And this man is a medical doctor. He's a German doctor, and he has given his life to this project in Peru. And we want to hear what he has to say about this hospital, how it started and how it is running, and what is going to happen in the future with this hospital. It is a Christian hospital serving many people, 300 patients a day, and a hospital that has been costing over $10 million with a fancy equipment, everything done by faith through this man and his wife. Doctor, welcome to this program. And it's honor to have you, Dr. John, on this program. So we want to hear your story. What has happened there in Peru? How come a medical doctor and his wife, your wife being a medical doctor also, how come you go to this unprivileged Quechua Indians, poor Indians, and build a fancy hospital? Why?
Well, my wife Tina and I, we went to Peru as tourists in 1991. We spent, in fact, 3 months traveling back and forth. We visited Cusco, Machu Picchu, Lake Titicaca. But we also saw, back in 1991, human suffering among the Quechua people. They are descendants of the ancient Incas. There are about 10 million Quechuas, and they really live in misery. They live in houses without electricity, no window glass, no running water, and most of them have no real access to medical health care. My wife is a pediatrician, I'm a surgeon. We met, in fact, 32 years ago, and when we met in high school, we said, well, we want to be in life medical doctors in a third world country. Well, we saw the need in Peru, that's what we always wanted to do, and now we live in Peru as doctors at a hospital which we built.
You could have made a real good life in Germany with German D-marks or now euros, and you have given up all that life. Why?
Well, the most fundamental question in my life was always whether God does exist or not. When I was a teenager, I was afraid of death, very much so. I thought, well, I have pain here, this might be bone cancer. And I also wanted to know, well, is there any hope after death? And, well, I knew that Jesus said, well, I give you eternal life, you would trust me, but I wasn't really sure whether this was true or not. And I thought, well, if I can believe in God, and there's hope for me and other people, I want to dedicate my life to God, and I want to tell everybody that there's hope. So I'm in Peru, it's true. I lose a lot of money by being a doctor in Peru, so my wife and many other doctors who work for us, but we are very happy people. And we know that what we do is necessary, and our patients are very grateful. But I tell you, many German patients are not grateful at all. Well, but even more interesting, when we built this hospital, well, you said we built it by faith, and that's true, because we started out without any money. We had just a vision, a modern hospital for the poor, with good modern medical health care, with modern operating rooms, and a CT scanner, nice laboratory, very expensive equipment. So we sat down in 2002, we wrote a proposal down, took us some 6 months, and it became clear we would need millions of dollars. And we would need first-class equipment, and even more difficult, 35 professionals willing to leave their countries, America, Germany, Finland, England, to move to Peru to live in very poor houses to serve without getting money from the hospital. Well, this was all completely unrealistic, completely out of this world. But what can I say? The hospital does exist, and we have seen many miracles. God has done mighty things.
Well, over $10 million worth of buildings and equipment. How did that come to happen?
Well, you know, when we started this project, At
When
one point,
was that?
In 2002.
Yes.
But this has been on our mind for many years, that perhaps we want to build a mission hospital. And I was always uncertain about it. I thought, well, how can this come about? And it's almost unrealistic. And I know that hospitals are very complicated structures, and it's expensive and everything. So one night I was sitting in Quito, Ecuador, because I've been working in Ecuador as a missionary for some years. I thought, well, this will never ever happen. And I was so sad and so frustrated. And that night I read Psalm 32. And in the Spanish Bible, verse 8, it says, well, God says, my eyes are upon you, I will direct you along, I will show you the way to go. And I thought, well, that's it. God will direct me, He will make it happen. I just have to be guided by Him. And we have seen God guiding us with every step we took. Unbelievable. Let me just tell you one thing. When you build a hospital, expensive hospital, you can lose a lot of money in a third world country. The money is suddenly gone. Where's the money? Nobody knows. And we thought, well, we need a specialist, a civil engineer, willing to supervise the construction, to use our money, which we get wisely. So, well, we looked for somebody with a lot of experience, healthy, who can stand the altitude, somebody who got third world experience and does the whole work of us without charging, free of charge. Well, we looked for a long time, we didn't find anybody. And now, you know, I was sitting together in February 2005 with a lawyer. We were talking about the contract between our organization, the Hospiciana, and the construction company, talking about $4 million without equipment. And the lawyer says, well, Dr. John, I belong to a group of about 20 Christians. We collect money for street children in India, in Sao Paulo, Brazil. And one of us used to work as a civil engineer. So I asked him, what is his name? His name is Udo Clemens. Do you have his telephone number? So he looks in his bag, he finds the telephone number, and I asked for a little break to call Mr. Clemens. And I said, well, Mr. Clemens, we are doctors, we want to build a hospital. And as Germans, we are very straightforward, almost rude. Would it be possible for you to supervise this project 1 year, 2 years, but we're not paying anything? So he tells me, come and see me tonight. I live 1 hour away from Frankfurt. So I visit him, I show him the presentation, the screen, laptop, projector. And as I finish, his wife says, Barbara Clemens is her name, Dr. John, my husband and I, we are committed Christians, Lutherans. 3 days ago, we started praying to God that God would please give us a special vision for our life. And this morning, we're sitting in the kitchen, pondering our hearts, what is it that God wants us doing? That very moment, the phone rang, it was you. Well, they did the job. In fact, for 2.5 years, he came to Peru.
So the hospital name is We Trust in God.
The Hospiciana.
What do the locals think about hospital We Trust in God?
In Peru, it's a Latin American society. There are many politicians, many people who make all sorts of promises, especially prior to elections. And in South America, you say, hechos, no palabras. We want deeds. We don't know more words. They have enough words every 4 years, and all lies, 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 lies. So when we had the groundbreaking ceremony, the people thought, well, that's a nice party here. There were 3,000 people, even the German ambassador. But people thought, well, this will never materialize. It's sort of, what a dream, a modern hospital here in the mountains for the poor people, yeah? They were skeptical, but the hospital was built. And in fact, 2 years later, on the 31st of August 2007, it was inaugurated. Big party with 4,500 people, and the First Lady of Peru and 9 TV teams came along. And then when we treated the patient with respect and love, people realized, well, this is true. This is not just a dream here, it's a hospital. And now they come from all over the place, and very popular, very grateful patients, obviously. And our trouble is we have so many patients, we cannot treat all of them. We need more Christian doctors who can help us. We need lots more Christian doctors.
So how many are in your staff right now?
Well, we've got 10 doctors now. Some are working only half-time. And next year, 4 will go back to Germany because they have then completed their rotation. They have been there for 3 years, one even for 5 years. Well, we need a committed surgeon. We need 1 or 2 in anesthesia. We need a pediatrician, an internist. We can use a radiologist, and almost any specialty. And there are so many patients, poor patients. We know from our database that 85% of all patients are very poor, most indigenous.
So do they come there for free, or do you charge them? What is there?
Well, we say human
System.
dignity requires that everybody pays a little bit. Well, they're no beggars, really. So they pay 4 soles, €1 about, to be seen by a specialist. That is the best price you can find in Peru. And if it's something more expensive, let's say we have a CT scanner, or X-ray, or endoscopy, medicine, an operation, then they talk to a social worker. And then he is trying to find out how's life at home, how do they live, do they have money and income or not. So we always try hard to help all our patients. And because we have a support group, many people, Christians and non-Christian, helping us, we are almost always able to help the people.
How about you are a doctor, your wife is a doctor. How is it possible for you to, as a European doctor, to go to Peru? You know, even if you go to America, you have to get a license, separate license. Was it easy to get a license to work in Peru?
You're touching a very interesting topic, because it's so difficult to get a license. You will not believe us. In fact, I went so many times to talk to the Peruvian College of Doctors. Well, and they knew that Jones had collected $10 million for the country, and we have been on TV in Peru many times. First, you have to find a university willing to revalidate your title. So I went to University Federico Villarreal. It's a big place, and I went there for a whole year, 20 visits, and I had to give them 150 pages. Well, legalizations, translations, everything. But on the 22nd of April, about a year later, after it started the process, we got the letter from the university: we are not recognizing your title. And I can't tell you, I was so frustrated, so sad. But you know, God has been so faithful to us, and He does miraculous things, really. And in March 2008, we had the visit from the health minister. And he came and he saw the hospital and everything. He spent 2 hours with us. And when he left, he was very touched, he was very moved. And he arranged for us a meeting with the president of Peru, Alan Garcia Perez. And this meeting happened on the 26th of April, 4 days after the negative response by the university. Well, we had a 45-minute meeting with the president. And they asked me, well, Dr. John, is there anything I can do for you? I said, well, we need the title, our license. He said, don't worry. We got the title directly from the dean of the College of Doctors, lifelong license for my wife and myself, with the help of the Peruvian president.
In Peru, there are a lot of poor people, and there are also rich people. How are the rich somehow helping your project, as they see you in TV and as they have seen the hospital in operation? How are they responding?
Well, among the upper class of Peru, and they're very wealthy people, millionaires even, you don't have the culture to give money to a good project. There's no awareness. We have received about $1 million from 10, 12, 13 Peruvian companies. We got cement, and we got steel for the building. One group donated a brand new ambulance, which is nice, electrical generator. So we got some help from the big business, but behind every single donation, there's always a miracle. And it's something special has happened to make this donation come true. And I'm just reminded of our satellite dish. I tell you, when we started the construction, in a region we had no telephone and no internet, and we had no fixed phones, just 9